Hi guys, welcome to my pathology presentation. My name is Jeanette Berry and I'm going to be talking about Parkinson's disease. And for the remaining of this video, I'm going to refer to Parkinson's disease as PD, just so that way I don't get mixed up on my words and mess it up while I'm on a roll. Anyways, today I'm going to be talking about what Parkinson's disease is, how it is diagnosed, what the PD effects are on the brain and in everyday life, and what the treatment options are. So without further ado, let's get started. So to start off, what is Parkinson's disease? Well, PD is a neurological disorder, meaning that it's going to get progressive over time, which means the symptoms of PD are going to get worse before they ever get better. So the symptoms of PD is what makes living with PD an everyday struggle. The symptoms of PD include tremors, which is shaking, and stiffness, making it harder to walk. So that's why sometimes people who are diagnosed with PD have to walk with a walker or a wheelchair for the day, because depending on the day, they might not have the strength or they might be too stiff to walk. And also there is bradykinesia, which is slow movement, and that kind of correlates with the stiffness and not being able to walk depending on the day. So because Parkinson's disease is a neurological disease, this means that the place of action is in the nervous system. And with this particular disease, it's in the brain. And what's really unique about PD is that it's not centered in general in your brain. It's just in a certain portion called the substantia nigra. And according to the National Institute of Neurological Disorders and Strokes, and in the article Parkinson's Disease, Challenge, Progress, and Promise, substantia nigra gets its name because of the neurons that you can see under a microscope that are black in the area. This is why substantia nigra is called what it is, because it is Latin for black substance. And also in the substantia nigra and the neurons, they produce neurotransmitters, which are called dopamine. Dopamine is what controls your movement in your body. This is why the symptoms of PD are what they are, because there is a lack of dopamine, which means there is a lack of control of movement. And there's another action in the brain that is caused by PD. There are proteins in the brain called alpha-synuclein that clump into Lewy bodies. Unfortunately, we actually don't know what this protein does in a healthy brain, so we can't really determine what goes wrong in the brain with PD with this protein. So now that we know exactly what Parkinson's disease is, we can move on to who it affects. So according to the American Parkinson's Disease Association, in their article, What is Parkinson's Disease?, there is an estimated that 10 million people in the world are diagnosed with PD currently. And 1 million out of this 10 million are in the United States. So the chances for developing PD are increased over the age of 50, and only 10% of cases are diagnosed under the age of 50. And fun fact, men have a higher chance of developing PD over women. And also ethnicity plays a higher factor in developing PD as well. And I mean this by, in certain ethnicities, there is a genetic factor that could possibly increase the risk of developing PD at a later age. So because the root cause of PD is idiopathic, meaning that we still don't know for sure what the root cause of PD is, there are a few common factors that we have developed over the years that could relate to the development of PD, and these are genetic and environmental factors. So according again to the National Institute of Neurological Disorders and Strokes, genetic factors occur in less than 10% of diagnosis. So if someone did develop PD, chances are it probably was not from a genetic factor. But the genetic factors that could trigger PD are the LRRK2 mutations along with the alpha-synuclein mutation as well. And environmental factors have a higher chance of developing PD, and these factors would include pesticide exposure, heavy metal contact, and head injuries. And the reason why that is hard to point a cause of PD is because there are so many years between the impact of the factor and the diagnosis of the disease, because most diseases do not occur until you are over the age of 50. So if that factor happened when you were way younger and you had an injury that related to PD, you won't find the occurrence of PD until after the age of 50. In the process of determining the diagnosis of PD, there is actually not a specific test in doing so. A physical test is performed by the physician of the patient who may be experiencing PD-like symptoms, and most patients are then sent to be evaluated by a neurologist and could also be referred to a movement disorder specialist. Some cases, brain imaging is involved, but this is not normally what happens because symptoms normally say it all. The motor function is what determines the diagnosis of PD. The only reason that there could be brain imaging involved is when the physician or the neurologist isn't quite sure, so they need to go in deeper to determine the diagnosis. After the diagnosis of PD, there are treatment options available according to the Parkinson's Foundation Living with Parkinson's article, and these treatment options will alleviate the symptoms, but they will not permanently reverse the effects of PD. And these treatment options differ in patients according to their severity and the symptoms that they are experiencing. But a lot of these treatments include medications such as dopamine precursors and agonists, which help to stimulate the dopamine production that will help to alleviate loss of motor control. And there are also surgery options available, but these are very risky and dangerous because a lot of these surgeries, including thalamotomy, destroy the brain tissue that is affecting motor loss, which destroying brain tissue is not good in general. It's just a very scary process. And the most common surgery is deep brain stimulation, which disrupts electrical signal versus destroying tissue, which is a lot safer than destroying tissue. And other treatment options include lifestyle changes and exercise. Thank you guys for listening to my pathology presentation. I hope you guys enjoyed, and I hope that was helpful on learning about Parkinson's disease.